Good evening, everyone. Welcome to the Healthy Start Parent Education webinar. Let me tell you a little bit about our guest speaker tonight. Dr. Jones was born and raised in Northern California. After completing his bachelor's degree in managerial economics at the University of California at Davis, he received his doctorate of dental surgery at the University of the Pacific School of Dentistry in 1983. For over 30 years, he has been balancing a career dedicated to comprehensive dentistry, serving his country and his community. Dr. Jones served as dental officer in the United States Air Force for 20 years, 7 years active duty, and 13 years in the reserves. In 1990, he relocated to Orange County, where he began his private practice and has become an expert in solving aesthetic and functional problems due to tooth wear, damage, and lost teeth, as well as occlusion and bite disorders. He is passionate about providing comprehensive dentistry to his patients to balance health, function, and aesthetics. Now, he's a lifelong learner as a member of the American Dental Association, the California Dental Association, Orange County Dental Society, Academy of General Dentistry, American Academy of Dental Sleep Medicine, American Equilibration Society, and American Academy of Cosmetic Orthodontics. He is a scholar member and ambassador of Dawson Academy. Now, Dr. Jones and his wife Debbie, who is a pediatric pulmonology nurse, are working together to create an awareness about the prevalence of sleep-disordered breathing in children in order to address and prevent issues he sees in his adult patients related to poor growth and development. Their vision is to provide children with a more proactive and less invasive treatment utilizing Healthy Start to promote proper growth and development of the jaw and airway to allow for the optimal airflow and nasal breathing, all while guiding children's teeth into the best possible positioning for a lifetime of health. Their goal is to help children breathe properly so they learn, grow, and become the very best versions of themselves. We're extremely excited to have Dr. Jones with us, and I'd actually like to take this time to invite Dr. Jones to share his screen and hand the floor over to Dr. Jones.
All right, well, I am so happy to be here tonight. I'm excited to spread the word about what we do and give you some information so you can look at your own children and find out if they have some symptoms and maybe get some idea what's going on with them. Maybe you've already have a concern and you would like some more information about what you're seeing. So if I don't answer your question, or if you have a question that comes up later, please post it or reach out to us. We are here to answer any questions that you have. I want to make sure tonight that you have the information you need so that you can proceed and address the needs of your children. This is a critical time in their growth and development. In order to be able to address these issues, not only are we looking to help your child today, but more importantly, to make a difference for a lifetime. Tonight, we're going to talk about airway, breathing, sleeping issues, and the underlying root causes that we can address with a system that is easy to use. Children typically passively wear it at night. It promotes the child's growth and development. It will correct improper habits, and it will help the child sleep, breathe, and develop an airway that will last a lifetime. 9 out of 10 of these kids suffer from one or more of these symptoms. You look below on this, look on this screen, and you will see mouth breathing, snoring, tooth grinding, swollen adenoids, tonsils, chronic allergies, ADD, aggressive behavior, depression, irritability, anger, peer problems, bedwetting, difficulty in school, delayed or stunted growth, restless sleep, nightmares, morning headaches, daytime drowsiness, sleep talking, walking. This truly is a silent crisis among Americans' children. So many times when we talk about sleep disordered breathing, people ask, what is this? How do I identify it? How do parents look at their children and kind of get an inkling of maybe something's not right, something's going on? We are fortunate that we do see outward symptoms, as I just kind of went down the list here, in these children's. However, they are not consistent from child to child. It's not like you're going to see in all children these same symptoms. These are just some of the symptoms that I read to you, but what I tell parents is that your child might be exhibiting maybe 3 or 4 of them, But when you look at the child, you may think each of them are isolated instances and not connected to one overlying root cause. So tonight, we'll be looking looking at that root cause, so you'll feel more comfortable and understand the relationship between these symptoms and what the root cause is going on: sleep and airway issues. Again, 9 out of 10 of kids suffer from more than one of these symptoms. With that kind of number, you really see that there is a silent crisis. Currently, it's estimated that over 40 million children in the USA suffer from one of these symptoms. So here we are, continuing. So what options do parents have with their children today? Most people, and I see a lot of families, a lot of friends whose kids are suffering from ADD or ADHD, and they're taking some kind of drug, some combination of drugs, and all these drugs have side effects. Sometimes these kids are taken for psychiatric testing, counseling, therapy, surgery, but they're not really, these things, these symptoms are not really dealing with the root causes. They're kind of like a Band-Aid, and they cover the symptom, they make the kid sleepy, their side effects, and they tend to be short-term, they tend to be expensive. So we're going to look for something that may be an alternative that's more holistic. Dental professionals, like myself, have the unique opportunity to be in people's mouths, and we look at people's airway, we look at their jaws, and we are in a very special position in order to look at the growth and development of children and make a difference. It's not about just filling teeth, about cavities, but it's really about taking care of the entire child, their entire human being. And we are going to be making a difference in the future of these kids as we identify what's going on with these kids and get them off of these drugs and make a difference. So when I look at a child, let's take a look at these two children like I would in my office. The little girl on the left, you notice she has dark circles under her eyes. Her head is kind of tilted forward. She just doesn't look very well. And then you look at the boy on the right, same thing. He's got dark circles under his eyes. His lip is kind of rolled. You might think that he might be a mouth breather, and they might not be sleeping very well. So take a look at your child, take a look at your grandchildren, take a look at your friends' children, and begin to look more closely. Now you look at this young lady on the left and her profile. If I drew a straight line like this, her chin should be roughly where my arrow is, and it's not, it's set back. This other young lady on the right, you look at her and she is almost like a funnel. Her, again, if I drew a line back, straight down, you see her lower jaw is set back, and she looks like her chin and her throat are all kind of combined together. These young ladies just don't look normal, and they don't look healthy. So when you look at these kids and similar problems, you ask, well, what is the root cause? So research over 20 years has related these outward symptoms that I've talked about to mouth breathing, a narrow palate, improper tongue placement, and jaw relationships. Mouth breathing actually is quite common, and so I would encourage anyone out there, if they're looking at their child tonight while they're sleeping, kind of sneak in and see, are they breathing through their mouth? Are they breathing with their mouth closed? I, as a dentist, would look at, okay, are their jaws constricted? Do they have like a narrow palate? Jaw relationships, which I just referred to looking at these young ladies in the previous slide. Do they have a deep bite? One of the ways that you can tell there might be a problem, they kind of look like a bucky beaver, where their upper jaw seems to be way forward, or their lower lip actually comes inside their upper teeth. Those are just indications that something is going on that's not quite right. So where does this all begin, and how does this relate to what we're talking about tonight? It all begins first with screening for sleep. So we have an initial screening tool that HealthyStart provides, which is an amazing tool to help identify symptoms of what might be going on with your child or a child of a friend. Snoring, the ones that really I see most often are children that are snoring, children that are grinding their teeth, children that are mouth breathing, like I said before, sometimes allergies. If you're breathing through your mouth, you're not allowing the nose to purify the air, to humidify the air, and dirty air is entering your lungs. So you can actually have allergic type symptoms that are created just from mouth breathing alone. We talked about ADD, restless sleep, grinding teeth. That's a common one that I hear among parents ask me about. My kid is grinding his sleep at night. Is that normal? And the answer is no, it's not. The incidence of sleep disorder breathing is done in this study, and it shows that the incidence occurs in children from 2 to 19 years of age, and was published in this 2016 issue. The results said that mouth breathing and snoring, as I said, are commonly associated with more sleep disordered breathing symptoms than any other symptom study. 9 out of 10 children had one or more of the symptoms of sleep disordered breathing, like I said before. 60% of the sample had 4 or more symptoms. 1 out of 5 children experienced bedwetting. And between 4 and 12 years of age, 92% of symptoms did not self-correct. Now that's why I got involved, because I'm seeing adults that have some of these symptoms. And as I've begun having discussions with my patients who are adults, so many of them are just so envious that they wish someone had got a hold of them when they were younger. I actually had a good friend of mine said that his brother was wetting the bed all the way through college, and they had seen doctors. He'd been hospitalized, trying to figure out what was going on. Nothing was successful. And something like this would have changed his life. So when I hear stories like this, I get excited. And that's why we're here tonight. Here is more detailed on the prevalence, mouth breathing, snoring, toxin sleep 31%, restless sleep, ADHD is 25%. What I find interesting is that mouth breathing during sleep closes and reduces the airway about 6 millimeters. Now it's important to know that a 7-year-old kid has a 7 millimeter airway. If you open your mouth and you close it 6 millimeters to breathe, that means you're only breathing through 1 millimeter. That's like breathing through a coffee straw. Most urgent for evaluation and treatment are in bold type, and that's one I just went over with you. Implications. Findings that sleep disordered breathing is much more common and affects children as young as 2 years old. That's what I'm finding in a daily conversation in my office. People just are not aware. It's not part of the normal conversation. Most physicians that I talk to are not aware of it, and most people are excited to say, wow, this is life-changing. The key is to begin treatment as soon as possible, because if we can make change in these kids young, it can be a permanent change for the rest of their life. Identifying the outward symptoms displayed in 90% of the children that enter your practice or my practice will significantly reduce. So I'm talking to you as parents tonight. So I'm not talking about what I'm doing in my office. What I'm suggesting and encouraging you is to look at children around you. Look at your own children. Look at your grandchildren. Talk to your friends and say, okay, do people we know or kids we know, do they have some of these symptoms? And maybe we can make a difference. Airway. It's all about the airway. And it's about what can restrict it and addressing the habits. Here's a little slide that I was talking about. We like to think of the airway for a child, the ideal airway, to be that of a garden hose. We talked about if they're breathing through their mouth, they're going to be like a coffee straw is depicted in here. It's so sad. I know someone that tried for 10 minutes to breathe through a coffee straw just to see what it would be like. They had such an insane headache after only 10 minutes, nothing they could do to get rid of it. And yet some of these children are sleeping at night, going around sleeping all night long with just breathing through a straw. I can't even imagine what they like, but that's their normal and they don't know any different. But where did this all begin? How did we get to this situation? My wife recently went to Uganda, and she came back, and this was before we had a lot of discussion about this, and she commented how everyone that she saw, all these kids in northern Uganda, had perfect teeth, huge jaws, beautiful smiles. And she said, what's going on? Well, the reason is, if you go back 300-400 years, you never had any issues such we're talking about tonight. Malocclusions did not exist. Anthropologists have been studying this for years, and they go back and say about 400 years ago, before that, there's no incidence of malocclusion. So what changed? Well, with the Industrial Revolution, you started having soft food. You did not have breastfeeding as the only means to feed a child. The diets were changed. And so what happens is that with breastfeeding, you actually promote the proper growth and development of the jaw and of the face, because the muscles that are required for a young child to feed actually promote the growth and development of the jaws. So if you take that away, you're losing some of the muscle activity that allows the full genetic potential to take place. At the same time, you have soft diet. Gerber, which I grew up on, it does not provide enough muscle activity that's required to properly develop the jaw, the face, and so you start to have narrowing of arches and malocclusions. Prolonged use of binkies or pacifiers continues the problem, because it puts the tongue in an inadequate position, again, to promote growth, and it can also promote open bites and malocclusions as well. Here are some of the examples that I was talking about. You look at these, the top one, that could be from a pacifier that was used way too long. It could have been used from finger sucking. Same thing on the bottom left. Could be a tongue thrust. Any of these things could have caused or led to these malocclusions. So as we're talking about airway tonight, let's just have a very quick understanding of what we're talking about. On the slide here, you'll see the nasal cavity, the hard palate, and the tongue, but I want to focus on the airway. So you have the nasopharynx, which is up through the nose, and then you have the oropharynx, which is behind the tongue, and then you have the laryngopharynx, which is down below. So we're going to focus a lot on the nasopharynx and the oropharynx here tonight. And these are the areas where you see in this green, this area right here, that we want to have like a garden hose. Breathing through the nose. We were designed to breathe through the nose. With the nose, the air is purified, it is humidified, as it enters into the body, the lungs. It warms and moistens it. Its cilia and mucous membranes trap the dust, pollen, bacteria, and other foreign matter, which are all potential allergens. So our goal, and we were made, is to train children to breathe through their nose. That's why mouth breathing is so important to address and try to train these children to breathe through their noses. This is a common scene in a child that is not getting enough sleep at night. This poor young girl is in a car seat. She's exhausted, and she has a moment, and she's breathing through her mouth. And you ask, okay, is this just been a long day at school, or is she just not getting enough sleep at night? This is a young boy, Eli, that shows a young child who has significant sleep and airway issues. And his constriction, notice his mouth is open. He's breathing through a coffee straw, and he's not getting enough oxygen in order to survive. And I want you to watch this and see what this poor child has to suffer through.
Now he's holding it. That was holding it. He's still holding it. He's trying to take in air. There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath, and he's going to gulp again. There he goes. That was it again. And it's holding. It's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds. You can see how many episodes he's had of not getting calm breaths in. Now, watch what happens when I take his jaw and bring it forward. If I can, let's see if I can. And I open his airway. Just bring his airway forward. There we go. Now he's breathing through his nose. Got his airway, moving his airway, pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose. Just hear him quietly breathing. You don't hear him anymore. And all I did is gently bring his jaw forward.
Wow. Is that powerful or not? So this video hit home to me. We used to drive from Southern California up to Lake Tahoe and put our boys in car seats. And one time we were going along, and I was watching my older son in his car seat, and had a similar episode. Now, I was not trained in this at the time, and I just saw that he had stopped breathing. He was sleeping, but I thought, oh no. So I shake him to wake him up because he's not breathing, and my wife has a fit because we're driving and we have a sleeping child, and now we have a cranky child. So this really made sense to me and hit home and reminded me that this is not a healthy situation. So if you look at your kids when they're in the car seat, please give it a second look, and you might want to give us a call. Here's an example of two different 5-year-olds on a lateral ceph that we can see what we're talking about. The red arrows on the left show a constricted airway on someone who has a retruded or a lower jaw that is back, and that with a lower jaw that is too far back creates a constriction of the airway, and you can look at it, it looks tiny. On the right side, here's a normal airway. There's your garden hose. This child is breathing just fine. Now here's something that shows the same child, but it shows the effect of when you open your mouth to breathe. Look on your left here. There's a child. You look at him, and if you took this picture and you just said, okay, great airway, there's your garden hose, not a problem. On the right side, now he's breathing through his mouth. Now you have about 1 millimeter or 2 millimeters of airway from 7 down to 1 or 2. So this dramatically shows what happens when you open your mouth to breathe, and yet forcing yourself to have less oxygen that you can get through your airway at any one time. Here is, again, what we're talking about. On your left, you see a normal developing child and someone who's underdeveloped. Again, if you look at my cursor and you go from the bridge of the nose and draw a line straight down to the chin, that's what you would like to see with a lower jaw that's come forward. That airway is nice and open underneath, as we just showed you in the previous slide. And look at this poor young man on the right side. He is underdeveloped on his lower jaw. The lower jaw is pushed back, and it is constricting his airway immeasurably, I'm sure. This is another slide that kind of gives you an idea of what we're talking about. I love this kid. On the right side, you see the ideal airway. There's a 7-year-old with a 7 millimeter airway. Nice and big, air going to flow through there. That young man is getting plenty of oxygen to his brain, to his organs. Now the guy in the middle, not so good. But the guy on the left, look at this. Can you imagine? Some people are breathing with an airway that small. There's no way that child is getting the oxygen he needs each night when he's sleeping if he's breathing only through an airway that small. So we have some fun ways to analyze airways. We have something called, these are CB scan. It's a 3-dimensional X-ray. And with this, we can measure volume. And so beginning at the age 5, you can multiply by 10 and get roughly the square millimeters of airway that's here. So this is a 9-year-old right here who should have 90 millimeters of volume and airway on the left, and you see he's only got 53. Now, what we can do with a habit corrector after just 1 month, on the right is this same child. He has the habit corrector in place, but now he is breathing through his nose. His lower jaw is forward, if you can kind of see it. The habit corrector is in place, and now there's 337 square millimeters, a giant airway. This is after just 1 month of moving the jaw forward and the habit corrector in place. So this is dramatic to see what these devices can do. Here are some of what we're talking about. 54 millimeters after 1 month. Initial pharyngeal volume of a 9-year-old patient is in the blue. The middle you have after a 9-year-old after 1 year. That is an incredible improvement. Now they're getting what he should be having at 9 millimeters. Then you can see with the device in place, you're getting your 337 square millimeters. After the scary thing is that after age 21, airway dimension decreases slightly. So your airway, as it develops, continues to improve until about 17 years. And then after 21, it starts to decrease slightly. So what we need to be thinking about is if we can get a hold of these children early, and we can guarantee that we can improve their airway, get them to be a normal size, and they can have the oxygen they need to grow, to be the best children they can be, to allow oxygen to go to their brains, to allow oxygen go to their organs. These young children, these young kids will begin to function at their maximum potential. So let's talk a little bit about the cycle on how we got here and where it takes us and why we're here tonight. We talked a little about this before, but extended bottle feeding and pacifier use causes poor tongue position. Let me just stop for a second to talk about tongue, because most people are not even aware of what the proper position of their tongue is. So just take a moment and say the letter N. When you say the letter N, that is where your tongue position should be when you breathe. Your tongue is elevated, it's on the roof of your mouth, but if you use a pacifier, the pacifier depresses the tongue and no longer allows it to sit at the top of the mouth in the palate. In that position, it no longer can perform its functions in growth and development. Sugar and processed foods have an effect. We talked about the Gerber, I call the Gerber effect. When a child no longer has to work his muscles to chew his food, the muscles are no longer allowing the proper growth and development, encouraging the jaws to develop to their normal size. Poor oral habits as well, thumb sucking, finger sucking, lip sucking, all those kinds of things contribute to allowing the lower jaw to be set back and compromising the airway. So the things on the upper left then lead to a compromised airway, reduces airway, restricts airflow, reduces oxygen. Oxygen is required for the brain to function well. So if you decrease the oxygen, guess what? It's not performing at its optimum. Immune functions, endocrine systems, swollen adenoids and tonsils. So when you breathe through your mouth, you're asking the adenoids and tonsils to do the job of the nose, to purify air, which they're not designed to do. So when that happens, they enlarge. Low tongue position, tongue thrust we talked about, underdeveloped dental arches, overjet and open bite. Overjet basically means bucky beaver, where the upper teeth are far ahead of the lower teeth. And open bite just means that you can't put your front two teeth together. And crossbite, which means the upper teeth generally sit outside of the lower teeth. In a crossbite, the lower teeth sit outside the upper teeth. All this will lead to sleep disordered breathing. And you'll see restless sleep, ADD, ADHD, bedwetting, allergies, nightmares, daytime drowsiness, aggression, defiance, anger, difficulty in school, and frequent infections. I love this slide because I'm kind of a geek. This is a MRI of a brain. On the upper three slides, you'll see REM sleep occurring. You'll see the red and the yellow, the activity that occurs in a brain that has been properly rested. And then you can look at the lower three slides and you'll see brain function with 1 night of sleep deprivation. If you've ever experienced brain fog after getting a poor night's sleep or staying up all night, you'll kind of relate to this slide, because after an all-nighter where you just didn't get any sleep, your brain probably feels kind of like this lower slide depicts. It's pretty empty, not a lot going on. Whereas the upper three slides show the red spots, there's hot spots, the brain's functioning. All this because sleep is required for proper brain function. Without sleep, that the metabolic processes that goes on inside the brain during the night cannot function. The brain actually is the only part of the body that is not part of the lymph system. So the lymph system is designed for the bodies to kind of clean out the bodies. When the cells work, they produce waste, and the lymph system basically clears the waste from the body. The brain doesn't have that. The brain has its own mechanism for cleaning out the waste of the cells during the night when you're sleeping. However, it only happens when you're sleeping at night. So if you don't get enough sleep, your brain basically is never fully cleaned out and rested and able to function at its best. So let's talk about HealthyStart and what we can do for it, where the options are. HealthyStart has treated over 4 million cases. They, as a company, I know, cared greatly and deeply about the safety of your child. So these devices are FDA cleared. There's no latex, there's no silicone. They're BPA free, BPS free, phthalate free, and they are regulated to a class 2 medical device. Way beyond that's required. You can actually put it in their body based on their ranking. So HealthyStart is a system, like I said earlier, and it's easy to use, and they are designed to treat kids at several ages. They have a toddler, which is 2 to 4. They have a kids range from 4 to 7, a preteen, and the teen and adult. So with this system, you can make a difference in adults as well as children. Our sweet spot is ages 4 to 7. And this whole system always starts with a habit corrector. The habit corrector is a device that it puts in the mouth. It's there passively. The child sleeps with it at night, and it helps the child to develop proper tongue position and to breathe through their mouth, and encourages proper swallowing. If you notice, each one of these all begins with a habit corrector. You'll see the toddler habit corrector, the kids, the preteen, and the teen adults. And I think I may have forgotten to mention the most important thing, or one of the most important things, that these habit correctors get the kids to breathe through their nose. So we're talking about symptoms, and now we're looking at, okay, what can we do to address these symptoms by getting to the root cause? So what are we able to do with the HealthyStart and with this system? We can expand the dental arches. The habit corrector is applicable to about 77% of cases require an expansion or widening the arches. The other cases, we would use something like a Schwartz or some other type of expander. As I said earlier that I forgot to mention, establishes nasal breathing. This is huge. It discourages and eliminates mouth breathing. It increases oxygen intake and ensures REM sleep. Nasal breathing prepares the air for optimal assimilation, filters, warms, and moisturizes, like I said earlier. Trains the tongue. It strengthens and conditions the tongue. The tongue is the muscle that promotes the movement or the widening of the arches. It repositions the tongue in the upward in the palate, allowing the palate to expand. It promotes proper swallowing and speech. It also helps eliminate bad habits. When you have the habit corrector, which hence why they call it the habit corrector, it helps to eliminate thumb sucking, tongue thrust, reverse swallow, and eliminates open bites. I was talking to a mom just today who was having problems and concerned with her child always wanting her binky, and would say, the child would say, "I want my bink, I want my bink." Well, instead of giving them their binky at night, we're going to provide a habit corrector in its place. It also advances the lower jaw, the mandible, to correct the overjet. Again, when someone has a Bucky Beaver look, it prevents the slippage of the lower jaw and tongue during sleep, so they can get the air they need. Therefore, it increases the airway. And it can correct most of the symptoms caused by sleep deprivation that we had talked about on the sleep study and the sleep questionnaire. It encourages proper facial and body growth, since lack of REM sleep impairs function of the adrenal glands to secrete growth hormones. And it also, by the way, corrects most orthodontic problems. It will create ideal overbite and overjet, allow the teeth to fit better together. Class 1, which is a non-dentist, probably doesn't understand a whole lot, but it puts the 28 teeth you have in place by the age of 12, which is huge, all without braces. One of the things that more on the physiologic side that's important is that when you use one of these appliances, and as they guide the teeth into eruption, the fibers that form around the teeth are attach the teeth in such a position that the teeth are in ideal position when they mature. The problem that orthodontists have traditionally, if they get a child when they're 10, 11, 12, and the permanent teeth are already in place, these fibers have matured. So when the orthodontist goes and tries to straighten the teeth at a later age with the permanent teeth already in place, you're fighting these fibers that are already stuck permanently to the tooth, and that's why you have relapse when you do, or at least that's part of the reason. One of the byproducts is that you reduce the chance for orthodontic treatment later, but even more importantly, I like to tell parents that I'm giving them the gift of time. which means that by the time they finish this system, if the kid does need some orthodontics to find two things, it's a lot easier on the child, it takes a lot less time, and usually less expensive. So there's a lot of benefits to dealing with this early. The habit corrector, that's what I was talking about. It all begins here. Myofunctional therapy is what it provides. Myofunctional therapy basically just means it allows proper function of the tongue and the lips. This is what it looks like. It has, the upper one is more for the young child. It has a pull tab, so if it's a young child may want to spit it out at night, you have the option of attaching it to the sleep clothes at night so it doesn't get lost in the sheets during the night. Notice the palatal tabs right there. So the tongue will rest against those and push against those and provide a natural force that will allow expansion of the jaw. It has a lingual shelf. It elevates in lower left here. There it is. It elevates and keeps the tongue in the upper palate. So it forces the tongue to be in the proper position, that end position that I was talking about earlier. And also there has some little spikes over here that prevents tongue thrust if they're a tongue thruster. Lingual tabs, that means basically tabs by the tongue that maintain the mandible or the lower jaw in a forward position and guides the lower front teeth forward. It prevents the lower jaw from drifting backwards. So all these things together provide the child to learn and develop proper tongue placement, to breathe through their nose, and then allow proper development of the face. One of the ways that you can kind of look at your own child to see, okay, do we have a swallowing issue, is to have them take a glass and just have a sip of water. When swallowing, you want to close your upper and lower teeth together. You keep the tongue elevated and the roof of your mouth. You keep your tongue tip, keep the tongue tip in back of the prongs. Do not move the lips. So when you look at someone who is drinking a glass of water, only thing that should move really is their throat. If you see a child contorting their face, making funny faces, that's not normal. And so that means you probably have an improper swallow habit and another indication for the habit corrector. We're talking about improving the swallowing and the myofunctional therapy. If you go to a myofunctional therapist, you maybe have an hour or so, and they'll give you some exercises to do. Like with any therapist or any time of exercise, when you say, okay, I'm going to go home and I'm going to get some kind of home gym device, and I'm going to do it four or five times a day or 4 times a week. Yeah, it sounds good at first, but over time you just kind of, you kind of give up, and that piece of home gym equipment usually gathers dust. The nice thing about these is that these exercises occur at night when the kid is sleeping and does not require any effort other than putting the appliance in the mouth. Think about it. You swallow during the daytime 2 times a minute during the day. At nighttime, you swallow 1 time a minute during sleep. For 8 hours, that's 480 swallows. Total day and night swallows, 2,400. With a habit corrector, 2 hours during the sleep, 240 swallows. You're getting total swallows with a habit corrector at 720. So typical myofunctional therapy swallows 200 per day. So you can see just with the exercises, you get 200. With the habit corrector, you're getting 720. Amazing effect multiplied when you have the habit corrector in the child's mouth, and how effective the training can be. To get an idea of what you can expect with the habit corrector, you have a sample of 220, and you go down the symptoms, and you can see the number of cases that have had improvement in this study. headaches 98%, and 93 had an improvement of snoring, labored breathing. Let's go percent with 100% of cases. Okay, headaches 85% had elimination of headaches, labored breathing 54, the interrupted breathing stopped 70%. So obviously, there are other issues that can affect a child in these symptoms. But I would say that you want to first start with sleep, because it is non-pharmaceutical, it is holistic, and you want to start first with a child that is normally breathing through their nose, getting the proper amount of oxygen, and see where you are from there once you kind of correct those issues. In this study right here, just by getting a kid to breathe through their nose and get proper oxygenation of their body, you're looking at 50 to 85%, 100% correction of their symptoms, which is amazing. Some more data here. 45% of bedwetters are completely cured just by wearing the habit corrector. So you look at sleep disordered breathing and ADHD. These poor kids are on all kinds of medication. The amount of money spent nationally just on ADD and ADHD drugs is astronomical. The side effects of these kids is sad. I don't think any parent I know is happy to have their kids on these drugs. They don't cure, by the way, their ADD or their ADHD. Usually the goal when I hear and talk to pediatricians is, I just want to help this kid get through school. What if we could get them functioning and not have to have any drugs at all? That would be amazing if it was my kid. The key results of that study: sleep disordered breathing increased risks of ADD and ADHD by at least 50%. ADHD patients have little or no REM sleep, but have delta sleep. So we were talking about earlier about REM sleep and about what was required for the brain to function. The red dots and the yellow dots of a brain that slept well and was able to function well. And the bottom slide, if you remember, there was virtually no activity whatsoever. So patients ADD and ADHD have little or no REM sleep. So just imagine on that study, if you take a kid with ADD and they're not having REM sleep, their brains were like the lower ones that had very little red or yellow activity. And these kids, this is their normal. This is all they know. ADHD is present in 25% of the cases, so it's quite prevalent. The long-term effects of sleep disordered breathing and sleep deprivation are 50% of these kids are held back 1 grade, 30% held back 2 grades. Again, like I said, Ritalin, the drugs, they don't solve the problem. They just try to mask it to get the kid through school. But the effects is catastrophic for these poor kids. If all they needed was to be able to breathe well and to get proper oxygen, the difference you're going to make in these kids' lives, being held back and held back again, just because their poor brains aren't getting enough oxygen at night when they're sleeping. IQ studies revealed that sleep disordered breathing can reduce the IQ by 10 to 20 points, which seems pretty amazing to me. But to put it in economic terms, someone did a study and said that each IQ point is valued at about $170,000 over a lifetime of a child. So if you can improve a kid's IQ by just 10 points, then you've improved their value, their potential by tenfold. HealthyStart, the system also promotes growth and development. So this is just a diagram that shows the proper growth and development of a young child's skull. You want to go forward and downward. What I want to point out to you, look at 2 years old, that 68% of the growth of the face is done at 2, 73 with a young female. But look at 12 years old. 12 years old, almost 90% of the face is completed. 94% of the female face is developed. So if we can get these kids somewhere between 4 and 12 before when we can utilize that extra growth, we can promote that growth and make a difference in these children. Here is a before and after of a child that was treated. Look at this 5-year-old on the left. Look at her eyes. Look at her upper jaw, her lip. I bet you her upper front teeth are flared forward. Her lower jaw is set back. And then look at her 2 years later. The lower jaw is forward. Look at her eyes. The forward advancement of the lower jaw creates 54% more growth and opens the airway. Going from a coffee straw on the left to a garden hose on the right. And a couple sample cases I can share with you. Here is a sleep study of a child. Take a look. There's 4, 4, 4s. It's a scale of 1 to 5, by the way. 0 meaning not present and 5 being pronounced. So this kid has lots of 4s, some 5s. The questionnaire also talks about speech because as we talk about improper development, tongue position, that also often affects a child's speech to pronunciate. So let's just move on. All right, so let's look at this young boy. He comes in, you see that he's got a deep bite. So ideally, you want to be able to see the lower teeth when the teeth come together. If you look on the lower central, his upper teeth are completely covering his lower teeth. He's got a square jaw. You want more of your lower teeth. Your teeth should be more looking like a rainbow. And if you notice, this is more squared off. Again, a sign of we've got a malocclusion here. Here he is a year later. Now look at the jaw, upper jaw. We're starting to get a nice rainbow-shaped upper jaw. The lower jaw on the right, you're starting to get that nice rounded look. Look at the lower central, the picture here in the bottom. Now you see his lower teeth. They have corrected that deep bite to it's almost ideal between the relationship between the upper teeth and the lower teeth. And here he is in 2 years later. Now look at him. Look at this jaw. Nice on the left side. You've got this nice rounded arch, plenty of room for the tongue. You've got a proper position of overjet, which basically means that the upper teeth cover the lower teeth at an ideal about 2 millimeters. This is an amazing result, all without braces, all by just wearing the HealthyStart appliance. Here's another case. Again, you see some crowding. If you see crowding in a young child, you're in for trouble because the baby teeth are smaller than the adult teeth. And if there's not enough room for the baby teeth, there is definitely not going to be room for the adult teeth. Again, she has the upper teeth are almost completely covering the lower teeth, so she's got a deep bite. Notice also on this young person that the teeth, they're worn. This child is grinding her teeth. It is not normal for a child to grind their teeth. If they're grinding their teeth, that often is an indication that there is an airway issue, and because their brain does not get enough oxygen at night, that stimulates grinding activity. Again, should be a symptom, should be a signal that, hey, something is up, something's not quite right. Now look at her, how she finished. Let me go back because that's so amazing. This is where she started. This is where she ended. Nice round arch, teeth in the proper position, plenty of room for the tongue. Here's another one. Deep bite. See how she has a gummy smile. You have lots of excess gum tissue. The upper teeth are covering the lower teeth. Now the teeth come in. Nice, broad smile. Not a lot of room for the tongue. Amazing result. This is all without wires and brackets. So let's just kind of review this. You got an initial. This is with the appliance in place. On the left, you can see how it fits over the teeth. Notice in the center, you have these two adult teeth coming in, kind of cattywampus, angled. Now the appliance in place will guide them into place as they erupt. This is that same, here's the finish, all by just wearing the appliance. These teeth, as they've erupted, have been guided into proper position. They went from the left all the way to the right. Absolutely amazing. Here's another one, start to finish. You can see these teeth are angled, rotated on the left, just by wearing the appliance, guiding them into place. We got a nice result on the right. Same thing. We've got teeth with spaces, and now we got a nice arch. And this, I love this young lady. Look at her. Look at her when she walked in, the dark circles under her eyes. You can see that she's almost biting her lower lip, how it's tucked in. She has a very narrow arch. And look at her teeth. The upper teeth cover almost all of her lower teeth. She's got a deep bite. So let's just see. Now look at her. We've got on the lower center picture here, we see a proper relationship between the upper and lower teeth. You see a lot of the lower teeth, about, I'm going to guess, maybe about 2 millimeters of overjet. Over here on the left, you see a nice rainbow-shaped arch. You see the gummy smile, most of it gone away. Look at her profile. Draw a line from her bridge of her nose down to her chin. Now let's keep this going here. Now look at this beautiful young lady. Look at her jaw now. She's got a rainbow-shaped arch. She's got, and look at her profile as you draw this line from the bridge of her nose down to her chin. Gorgeous smile. Now look at her. Now she's a young woman. She is able to have, she's breathing well through her mouth, through her nose, excuse me. I love the way her overjet and overbite, her teeth, it's beautiful, gorgeous smile. This is a Hollywood smile. So snoring, bruxing is just grinding your teeth, bad breath, ear infections. These are all symptoms that can be related to breathing through your mouth and not through your nose, by not purifying the air, not getting enough oxygen. Snoring is not normal. Snoring occurs when you have a small airway. You can have a decreased airway and not make any sound, but if you're snoring, you are guaranteed to have some kind of reduced airflow. This is another case. This is an Alaska boy. That's where he started. Let's check out his sleep questionnaire. He had a 5 on allergic symptoms, recurring headaches. Those were his big issues. He was trained with the habit correctors to start breathing through his nose. I'm going to go back. So let's look at allergies. Headaches, they went from 5 to 0. That's huge. Just by improving his bite, so the muscles in the face can be coordinated with the teeth and not putting excessive stress on those muscles so he can bring his teeth together properly. So I told you before that I mentioned that bruxing or grinding teeth is not normal. So if you notice your child is grinding their teeth or shows signs of worn teeth, that would be a flashing red flag, flashing red signal that something is not right, something is amiss. There's a reason that they're grinding, and it usually is lack of oxygen. This is the case mid-treatment. 14 years later, beautiful outcome. No brackets, no wires. So hopefully tonight we've talked a little bit about what Healthy Start is, what it can do, and most importantly, why I'm here is that it allows us the opportunity to change lives. You can take children that may be destined, if nothing is done, to have a life of sleep apnea, to be wearing a CPAP, to have less success in school. During the presentation, I didn't talk about the effects of oxygen, lack of oxygen as far as school goes. Studies have shown that when you decrease the oxygen, math, science, and spelling seem to be the one areas that are affected the most, especially math and spelling. And they have taken children that have struggled in school and put them in the habit correctors, got them to breathe properly, opened up their airway, and all of a sudden these kids are doing better in school. You're changing lives in so many different ways when you just give a kid a chance to breathe properly and sleep well. Thank you for being with me tonight. I hope you enjoyed it and may have learned something. Let's see, any questions out there?
Hi, Dr. Jones. First of all, thank you so much for taking time out of your night to share this important information. There are actually a couple of questions. So the first question came from a parent, and they said, my son sucks his thumb. By using the appliance, will that replace his thumb sucking? And then the second part of the question is, would he have to wear it during the day when he's at school?
Yes, it will replace the thumb sucking. And no, he does not have to wear it, and he would not wear it at school. This is a nighttime device. It may take him a little while if he's used to it, but quickly most children will adapt, especially if they have encouragement from mom and dad.
Yeah, absolutely. Thank you. Okay, second question is, can you tell me where I can find a sleep questionnaire, because I think my child might need to get checked for this?
So if you go onto my website, there is a copy of it on the website. You can just download it, fill it out, or send it to us. Or just print it out and take it to your dentist if you have your own dentist who is doing Healthy Start. We have it on the website.
Yeah, and also just so you know, there's a sleep quiz too that I posted on the. So if you're joining, I think that question came from Facebook. So I posted sleep quizzes on the different watch parties, so you can take that sleep quiz as well. So if you visit Dr. Jones's website, he has it up right there, www.MikeJonesDDS.com. You can get it there. You can take the sleep quiz. Either way, we'll get the information back to him. So okay, so the next question is. So Healthy Start will help my child sleep and breathe better and straighten his teeth. Is that correct?
That is the idea. Yes, absolutely.
Okay, perfect. So I wanted to thank you again for Dr. Jones, for you being with us tonight, but also there were so many parents that joined us this evening who jumped on Facebook, who listened in on the watch parties. I have a feeling that this information is going to be shared quite a bit over the next a week or two. And I implore you to do that. If you're a parent who is tuned in, once you know this information, it's difficult to unknow it. And so share it with the other parents that in Dr. Jones, it's so gracious to offer these Healthy Start days where you can bring your children in for a free Healthy Start dental screening. I mean, it's key. There's really nothing to lose, everything to gain. And, the symptoms that he was showing, if your child exhibits even one of those symptoms, call them up and set up an appointment. have your child screened. I mean, it's definitely worth it. You may want to, a couple things you can do. You see the dates that are up on the screen: November 15th, 22nd, December the 6th, and January the 3rd. You can take a screenshot. If you're watching from your computer, just take a quick screenshot. You can, if you're on your mobile phone watching, you can take a screenshot with your phone. But also, if you want to leave your email address, or if you want to direct message or private message your email address, and we'll be happy to send these dates out to you as well. And in fact, we may want to post them on the Facebook page as well. So we'll post these dates on the Facebook page as well. So tune back in and or check back, and we can so you can find out when these days are. Thank you guys so much again for your generosity, for offering these days, and for taking time out of your schedule tonight to just, you know, talk about this information. It's so important. So I want to thank you again for doing this.
I did have one follow comment with that last question.
Sure.
Is that I like to think of Healthy Start also giving parents the gift of time. So when we straighten the teeth with the Healthy Start appliance, even if about 75% roughly don't need any orthodontics, any braces afterwards, but even if you do, you're in that 25%, it is much easier, it's less costly, and it doesn't take as long. So yeah, it's a great beginning for the kid.
Thank you so much. I appreciate it. Guys, thank you for your time, and everybody have an amazing evening.
Good night.
Good night, everyone.